Hi, my name is Brandon, and I'm an alcoholic and addict in recovery. It's often difficult to know how to address someone who you are close with and who has a substance use disorder. Popular TV shows like Intervention portray scenes of people emotionally pleading with person with substance use disorder. A lot of tears, a lot of things like, I love you so much. I just want the best for you. And the problem with situations like this is that it makes the disorder more about the emotions that people are having than the actions that the person with the disorder is having, that the actions they're doing. And so reading a little bit about this from Fuck Feelings by Michael I. Bennett and Sarah Bennett, I'll talk a little bit about how they approached this, and then I'll talk about how people approached me when they felt I needed to do something about my substance use disorder. So they say, we all want what's best for those we love, which is why our first instinct when we see signs of alcoholism or drug addiction is to express worry, argue about whether or not a problem exists, and push for treatment. If we argue too much, or if the addict tends to behave badly while under the influence, we get angry and then feel guilty about that. Everyone can agree that the one thing that can both cure Everyone can agree that the one thing that can cure both her addiction and our discomfort is the aforementioned treatment. Unfortunately, however, given the way people usually react to other people's advice and the fact that treatment often doesn't work, especially when agreed to only to placate others, urging addicts into treatment often backfires. For one thing, intense urgings usually wind up making the addict and non-addicts involved feel the problem isn't addiction, it's your feelings. And her goal isn't to evaluate or improve herself, but to make you happy or change your mind. She feels responsible for your feelings, you feel responsible for her rescue, and her responsibility for her own well-being and self-control gets lost in between. And this is one of the most common things that I've read in critiques of interventions in general, but especially in the way that the show Intervention portrays that process, is that it creates an environment where the addict or the person with substance use disorder feels like the goal of treatment and sobriety is to make other people happy. And that's not a good goal to have in sobriety or recovery. Goal in sobriety and recovery should be self-motivated, should be about the self and improving the self and being a better person, not about making other people happy. In fact, for a lot of people with substance use disorders, trying to make other people happy is part of what drove us into addiction in the first place. So we've got to be very careful with making emotional pleas to people with a substance use disorder who we would like to see change their behavior. What does work better is to approach it from a much more business-like standpoint, which might seem cold and uncaring, but it also sets boundaries on the relationship and acceptable behavior in the relationship. And that's really what a lot of people encourage in interacting with someone who has substance use disorder. Set boundaries about the acceptable behavior in that relationship and then hold true to those. So what they say about this is, fortunately, however, there is a better way to discuss sobriety with an addict or to determine whether someone's drug use is dangerous. than by creating an emotional or any other mandate for treatment. It begins with accepting your inability to rescue someone from addiction, an acceptance that is as hard as an addict accepting his or her inability to control addiction. It requires you to keep intense feelings, including fear and anger, to yourself. It allows you to be potentially helpful with less risk of doing harm or being harmed. So if you're called on by love or bad luck to rescue an addict, slap yourself and get help right away. So it's really important to remember that we have very little control, if any control. In fact, we don't have any control over what other people do. But what we do have control over are the boundaries that we set on our relationships. And when my wife approached me about seeking treatment for some of my for my substance use disorder, she approached me in a very, very well calculated manner. It was not from an emotional place, although emotions were involved, because we were going through a very difficult time. But I had several people over the course of a year or so introduce the idea of treatment to me, and mentioned that some of the issues that I was experiencing, that I acknowledged some of the emotional issues I was experiencing, might be helped by some kind of treatment. But it had gotten to a point where my wife felt something more was needed, and she sat down and discussed it with me and basically laid out the facts and said, here is what I'm seeing, and here is what I'm no longer willing to live with. I'm no longer willing to accept this as a normal life for us. I'd like you to talk to this person about what options are available to you and get some advice on what you need to do to get your behavior under control. And that was it. It was a very simple conversation. But she didn't use a lot of emotional leverage on me. She set boundaries, and she, in very specific terms, said, here are the things that are happening that I can't accept. Here's the solution I'd like you to seek. I'd like you to explore, but left that open-ended. She didn't say, I've researched all the treatment centers in the city, and here's the one I want you to go to. She said, I want you to talk to our doctor, our counselor, about this issue, and take her advice. And it became very clear to me that something needed to be changed, or else our relationship could not continue on the terms it was currently on. And that's not an emotional thing. That's more of a business. That's kind of a business-like way of dealing with things. Saying, just, hey, what's happening now is unacceptable. So it's the ball's in your court now. You can either make some changes, and we'll see how things go, or you cannot make changes, and this current arrangement will no longer work. It's your choice. That approach worked really well for me. Had she, I will say that there have been times in the past where there had been more emotional pleas, and those did not work. So I think it's really important to understand that the way that the intervention is portrayed on TV, and the emotional approach to trying to get someone with substance use disorder to stop the behavior they're doing, often is not helpful, and in many cases actually backfires. It has some unintended consequences in terms of getting the person with substance use disorder to change their behavior for the wrong reasons, to really have an impact on people that you care about, the best thing you can do is approach them in a very, very objective way and set boundaries. And indeed, if you do go to any kind of treatment, especially if you go to family treatment, you hear how important setting boundaries is, not only for dealing with substance use disorder, but in any kind of relationship at all. That's it for today. I hope you have a good one, and I'll be back here tomorrow with more.